Are there specific biomarkers for immune system dysregulation in lupus? When we talk about lupus or systemic lupus erythematosus, we are discussing a complex autoimmune disease. This condition is marked by the immune system mistakenly attacking the body's own tissues. Identifying specific biomarkers, which are measurable biological indicators, is essential for diagnosing lupus, monitoring its activity, and guiding treatment decisions. One of the primary types of biomarkers in lupus are autoantibodies. These are antibodies that target the body's own nuclear and cellular components. The most recognized among these is the anti-nuclear antibody, or ANA. While present in nearly all lupus patients, it is not specific to lupus alone. Another important autoantibody is the anti-double-stranded DNA, or anti-Ds DNA, which is more specific to lupus and often correlates with disease activity, particularly in kidney involvement. The anti-Smith antibody is also highly specific for lupus, although it is less common. Other autoantibodies, such as anti-Rho SSA, anti-La SSB, and antiphospholipid antibodies, also contribute to the overall disease profile. Complement proteins are another set of biomarkers. These proteins, specifically C3 and C4, often show decreased levels during active lupus flares. This decrease indicates consumption due to immune complex formation and inflammation associated with the disease. Additionally, elevated levels of pro-inflammatory cytokines, such as interferon alpha, and changes in immune cell populations, particularly T and B lymphocyte subsets, indicate immune activation and dysregulation. Recent research has introduced emerging biomarkers through advanced techniques like immune receptor, gene sequencing, and bioinformatics. For instance, specific T cell receptor gene usage patterns have been linked to the severity of lupus and its organ involvement. This could lead to more precise classification and monitoring of the disease. Furthermore, dysregulation of genes involved in immune tolerance and circadian rhythm may play a role in lupus development, suggesting new biomarker candidates. While these biomarkers enhance our ability to diagnose and manage lupus, it is important to note that no single biomarker can definitively diagnose or predict all aspects of the disease due to its heterogeneity. Therefore, healthcare professionals often use a combination of clinical evaluations and multiple biomarkers in practice. In summary, there are specific and well-established biomarkers for immune system dysregulation in lupus, primarily autoantibodies and complement proteins. These are widely used in diagnosis and monitoring. Advances in molecular biology are expanding the potential for new biomarkers, which may lead to more personalized care for lupus patients in the future. However, ongoing research is essential to validate and integrate these new markers into clinical practice. Patients should always consult healthcare professionals for personalized medical advice regarding their diagnosis and treatment options.